Welcome to K6 Wellness Revolution, where we believe health is worth fighting for. This podcast focuses on all things related to natural health, wellness, and vibrant living. We know your time is valuable, and I'm honored that you're spending some of it here. So get ready, because the Wellness Revolution starts right now. Welcome to the K6 Wellness Revolution podcast. I'm Sharon, traditional naturopath and family nurse practitioner at K6 Wellness Center in Dallas, Texas. This is where we blend trusted expertise, compassionate care, and a passion for helping you achieve optimal health. Because wellness isn't just a goal, it's a revolution. And today, we're excited once again to visit the subject of exosomes. We're going to have a more focused discussion today on the use of exosomes of differing types in cases of chronic and debilitating health issues such as autoimmune disorders and even cancer. And I'm so excited to be joined by Mark Durante. Mark is the founder and CEO of Rise Up Medical, a company dedicated to empowering medical practitioners to incorporate cutting-edge regenerative therapies into their practices, enhancing patient care and transforming lives. Mark helps practitioners identify and integrate innovative biologic products into their practices, focusing on delivering exceptional patient outcomes. And he's been a true blessing here, providing lots of education. But Mark's journey began when he experienced a debilitating health crisis, culminating in a life-saving heart transplant. While grateful for a second chance, he found himself battling relentless pain caused by severe neuropathy. And the turning point really came when he discovered the transformative power of regenerative medicine, experiencing firsthand its ability to alleviate pain and restore functionality. Thank you so much for joining me today, Mark.
Oh my goodness. I am so glad to be here, Sharon. You know, I mean, you and I get into lots of discussions. Now we're just recording it.
Yeah, true. Yeah. Hopefully none of us is worse off in the end. No,
absolutely not.
no.
I know I always walk away better for it.
No, I have been so excited to have this conversation with you. Every time I text or we talk or you come over to check on us, I mean, I learned so much. So I'm really excited to share this with our audience today. And what we're going to cover today is really a more in-depth discussion, but an explanation of exosomes and stem cells, and how stem cells and exosomes, and even something called natural killer cell exosomes and acellular stem cells play a role in regenerative medicine. So I think to begin with, would you give us like the nuts and bolts, what is an exosome, but then what is an acellular stem cell and how is it different from stem cells and exosomes?
All right. Well, you gave me a lot to unpack there, Sharon, and I'm ready. No, that's great. I think when we first talk about exosomes, oftentimes I will give a simple, story. And I kind of love it because it always lets you think back on your grandma. But you remember the days when grandma always wanted to send you some sort of birthday gift with a little bit of some money in it, a card, just kind of wish you a great time. Well, when we think of exosomes are like the envelope that she put everything in. But the goodies that make a big difference is everything that grandma puts in the card. And at that point, she gives it to the mailman. He delivers it to your house. All of a sudden, you get to open that up and you get to use all those goodies. And that's just kind of the way that exosomes work, because every cell communicates by the way of an exosome. Just kind of think of it like a carrier vehicle. It's carrying a bunch of regenerative, proteins in it that are going to basically assist the next cell. So you kind of package up all these goodies into this envelope in one cell, and then you transfer them over to another cell. And that's when it's unpacked and it's used by that cell in order to create regeneration. So when we look at that, that seems like a very simplified, example, but, you could use the grocery bag as an option as well. But at the end of the day, that's what it is. And I think a lot of times when people look at exosomes, they only think of them from traditional stem cells. But what people have to realize is that every cell in the body has a particular exosome. The reason why we're using these exosomes from these, mesenchymal stem cells that are coming from umbilical cord or placental-based tissue is because those cells have not been specified, and like one of the things we talk about in terms of regenerative medicine is we want those unspecified mesenchymal stem cells because at birth, they're what has the ability to transform into anything. They can become skin, they can become brain tissue, they can become bone. And what a lot of people don't recognize is that once you've been chosen for a team, that's all you ever get to be for the rest of your
You're
life.
always on that team.
That's right. So until science is changing doing some crazy stuff that could bring some change to that in the future. But for right now, bone is always going to be bone, muscle is always going to be muscle. So when we're doing this, there is a lot of power punch regenerative proteins coming from these stem cells that have literally are creating life or creating growth once we've been born. And so when you start to look at that and you kind of gravitate in terms of, well, we know what an exosome is, but now what is a stem cell? Well, a stem cell is the entire body. It will carry exosomes in it, plus it will carry a bunch of other important ingredients, scaffolding, and you think of every kind of mixture that's possible to make a human or make any type of tissue type, it's present. But then what we do is, and this is happening in the very earlier days, exosomes are great but we look at them more for acute cases. And Sharon, you and I will probably talk about that a little bit later on. When we start thinking about acellular stem cells or stem cells, we start thinking about more chronic conditions.
Right.
And why is that? Because exosomes only carry so many signals. So you might be looking at maybe 700 to 900 different proteins that are producing these signals that can play in great support. But the other part too is exosomes are designed to come in a very short-term standpoint. They only hang around for 2 to 4 hours and sometimes up to 24 hours in terms of if they haven't done their job by that time or made their way into some sort of cell, they're kind of gone.
Mm-hmm.
Where what happens is when you're dealing with kind of these acellular structures or even cellular structures, they create almost a stickiness or a scaffold that will hold these certain signals in place, and they can signal for 2 to 5 days, sometimes even as much as 7. So that's why when we look at this, when we're trying to treat, when we're seeing practitioners treat more chronic cases, we're looking for the sticky factor that's going to let them continue to secrete their signals over a longer period of time. When you're dealing with more acute cases, like, early injury, we can get away with those less sticky type exosomes.
So the acellular stem cells you talked about in regular exosomes, maybe there's like 700 to 900 different
Signals, correct.
or signals. So are the acellular
proteins.
stem cells the same, that there's only about or the same number, or are there more signals?
Yeah. So the one thing I want to preface is that an exosome can package up anything. So maybe there's 4,000 proteins available, right, in a stem cell. There could be any variety that are mixed up in these exosomes. And when we traditionally say, hey, there's about 700 to 900, is that science is showing us is that if you kind of create this roundabout kind of like group, kind of think of your best friend group, there really is about 700 to 900 different protein structures that are found there. Even though you could have the whole 4,000, family members, they're really predominant in about 700 to 900 of those family members. When you start looking at whole cell stem cells and what we call an acellular stem cell, we're seeing 3,200 to 4,000 different protein sets being available in order to play a role in the regenerative space. Now, to give perspective to acellular, and I want to give some example to that one, is think of a whole cell stem cell as kind of like a water balloon. And what happens is when we create this acellular structure, what we do is we pop the water balloon or the balloon structure and we collect all the water that's inside. So we're collecting all of the scaffolding and different regenerative proteins that are present in that stem cell as a whole. So if I had a stem cell sitting here off to the side and I had an acellular stem cell sitting right next to it, they would have the identical protein set. It's just one of them doesn't have a wall to it, nothing to hold that structure in place. Now, what's important about that too is acellular stem cells are not a living structure. They're a biologically active structure. Okay. So when you look at that, this living structure of the whole cell stem cell has the ability to morph into something because it has an outer membrane that can morph. But once you pop the balloon, now what you've done is you've created a flood of proteins that are all going to now play a role on the cells, but you can't morph a soup into anything.
All right.
Once the packaging is done, it's done.
Yeah. You let it out and you can't put it back.
Correct. Exactly.
Space back in the tube.
That's right. Don't drop it,
Yeah. Yeah, for sure. You don't want to drop the acellular.
No, 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 not at all.
Okay, very interesting. And so you said that, with exosomes, like basically if they have not made their way into a cell, in a few hours, is that
Few
right?
hours,
That
yeah, correct. To
that
24 hours, up to
because I
24
know with
hours.
stem cells, like with PRP, when we do that, we tell people, look, 12 weeks for full expression. So with
Correct.
exosomes, the question that we get is, how long does this last? How long before I feel anything? Which, oh, I hate that question because
Oh, I know.
I know I want you to answer that question. I know what my answer is, so I'm going to check myself with the master over
Yes.
here. So Mark, if I just do a regular exosome, how long till I feel a difference?
Yeah, well, you know what? That's good. That's actually a great question because, here's the thing too. We talk about the repair process lasting 60 to 90 days. The one thing that I will express to people is that they can relate to is if you break a bone, you're in massive pain, but then the doctor resets it, puts it in a cast, and now the pain's kind of gone away. You can walk about with the structure, but it's not strong enough for you to start running again. There's going to be that 6, 8, 12-week time frame where that bone is going to fuse and create something that you will soon be able to run on. But that takes time. So
Mm-hmm.
when we talk about things like, 2 hours, 4 hours, 24 hours, 5, 6 days, what we're talking about is the impact it's making on those cell structures right there. It's kind of like thinking about this. You're walking into a factory that doesn't have the lights on, it's not manufacturing anything at this point, or it's got very low production. When we're doing something like exosomes or acellular, what we're doing is we're going on and turning all the lights on. We're making sure that it has all the raw materials because those cells will continue to make proteins over 6, 8, 12 weeks and even further on. So kind of look at it as we're turning the lights back on in that manufacturing plant that's going to work for a much longer period of time.
Yeah. And I always tell people too, like, well, some of it depends on how bad your health issues are, how severe it is,
Correct.
how many health issues. Just like if you have 10 broken bones versus one
Correct.
broken bone, healing's probably going to be a little bit different because your body still only has so many resources to, give over to a certain function. So same thing with the
That's
exosomes. It's
that
divide and
no, that
conquer.
that that is exactly it. And and ones like when we look at this, and I don't want to oversimplify exosomes because they're playing a critical part in
Sure.
regenerative medicine at this point. But when we talk about acute, a lot of people don't understand because a lot of practitioners, you see these shifts happening in the field where, one that was very powerful in stem cells wants to stick with stem cells. Then another one says, well, hey, these exosomes came along and the studies are saying they do the same thing, but they're not recognizing they're not the same thing. They don't have all the same ingredients. And so when we look at this, though they carry the same subsets of proteins, it's just different, right? Because we just talked about how the acellular or the whole cell stem cell
Mm-hmm.
can have 3 to 4,000 different protein sets, while you can have exosomes, which may have 7 to 900. We don't know what signals are going to make it in there, but we want to make sure we have enough of them that they're doing the right job. And, um, honestly, we could roll off into 100 different directions with this. So, I
Yeah.
always tell
Yeah.
everybody, it's like when you have this kind of information running through your head, you can take a lot of rabbit holes.
So yeah, right, for sure. And so that's exosomes, but really the acellular that I definitely want to dig deep with you on, that's one, where now where sometimes for people I'm telling them, hey, exosomes, you might want to come get, every 2 to 4 weeks, you may want to
Correct.
get treated with them. But with the acellular, what's the difference in the number of treatments and then expected,
Yes,
you
yeah,
know,
and that's actually good because when you're doing exosomes, you're treating something that's more of an acute injury, and you're just keeping kind of
mhm,
flooding the system or keeping it optimized. I love exosomes for acute cases or where you're looking at more wellness, longevity, prevention, that sort of thing. But when you're dealing with chronic disease state, a lot of times what practitioners will say is that I don't know which protein is going to make the big difference in helping this. So it's one of those things that you are kind of throwing everything, all the chicken soup,
yeah.
you know, out there because, the nice part about it is I say the proteins are here so micronized, they can see what modern medicine can't.
Yeah.
I always give the examples, and we'll talk about this later on, but we'll have practitioners that will say, well, one of my patients went through and did a body scan and they don't see any cancer, but when I take their blood, I am showing cancer markers.
Mhm.
So there's something there, but modern science can't see it. And so when we look at this, knowing that these stem cells have proteins that can reach areas that we never even thought, but which protein is the one that's doing it? I think it's important to say that the field is still very young. There's a lot of studies that are being done. There's a lot of things that are being, revealed. And, I think we've got a subset of proteins that we all feel are playing a contributive role, but there's so many in the body. And sometimes when you just kind of give the whole honeypot, you find out you get a much better result, which is why we use those more towards the chronic cases.
Yeah. And so for the acellular stem cells, using it like for chronic, many autoimmune cases, one I think of is like chronic Lyme,
Oh, yeah.
and people who long haul COVID. I know we have
Correct.
an interesting study on that one that I wanted you to
Yes.
talk about. But looking at things like that with the acellular, we're not worried about somebody necessarily coming in every 2 to 4 weeks and getting more and more and more and more, which is good because it's a little bit
Correct.
pricier.
Correct.
But you're
Yes.
going to, like you said, you've got a longer afterburn, I guess, like
Correct.
there's this after show that continues to happen after the treatment is over.
That's right. And you kind of talked about, how many treatments are in each one. When we try to go over to the acellular, we're trying to get you to the end result within 1 to 2 treatments. When we're doing exosomes, if it's an acute case, it could be in the same fashion. But if you had a chronic case and you're trying to use exosomes, you could be 3, 4, 5 treatments trying to accomplish the same thing. So a lot of times people think they're saving money, but in the long run, if they use the wrong product, they're actually spending more money to
Yeah.
get that result, and could be missing some key proteins that were really going to make the key difference. So that's where I started really kind of breaking things down into acellular for chronic, exosomes for more acute and more prevention, model. And it is, and here's the reason too. When you look at it, when you look at traditional studies, and this is what nobody pays attention to a lot of times, is the amount of exosomes that are being used in a traditional study might be more than what a patient could actually afford. Because these are
Right.
sponsored studies, right? So in a lot of cases where it's like, hey, we can throw 500 billion, a trillion exosomes at it, and they can get this fabulous result. But then when you put that to a monetary level, all of a sudden somebody's going, well, what
Oh,
can you get me? How many exosomes can I get for this? And you're
yeah.
like, okay, probably 50 billion.
Yeah.
And then you're going, yeah, but I want the same outcomes as the one that did 100, 1 trillion exosomes.
That's a really good point.
Yes.
That's a
And that's
really
one of
good
the reasons why you as a practitioner are trying to help guide them in terms of what's the best choice.
Mhm.
Hey, at this point, if you're just wanting to feel better, exosomes might get the job done. But if you're coming to me with these various, chronic related issues, then that's where we're going to have to go down this route. Because honestly, even, and you and I talk about this at the same time, we don't want them spending more money to get the same result. And when
Right.
we were doing the third party testing on the acellular versus the exosomes, one of the things that we learned is that in comparative ingredients, the acellular product, 1 cc to 1 cc, had 3 to 5 times more of those ingredients that were found in the exosomes.
So you really
Plus,
are getting more bang for your buck.
oh, you are.
Yeah,
I mean,
for
it's
sure.
simple as that, and that's why when you look at it and you start to do the math, every time they're doing exosomes for some sort of chronic related issue, they're actually spending more than if they just did the acellular right off the bat.
And that's been a real paradigm shift for me just in my head, because when I first learned about it, it was like, oh, this is for like the really, really bad stuff, the people who
Hmm.
can't like get out of
Correct.
bed. And
Correct.
to me, it was more on the severity continuum, but
Yes.
really it's more on this how chronic is it, the
Yes.
chronicity of the issue, because I know like doing joint injections, doing the
Correct.
acute injuries, doing the smaller exosomes, it's like we get really good results.
Oh,
But for a chronic joint,
yes.
like it's
Correct.
you need all of the zhuzh, as I say, you need all the
Exactly.
proteins, all those signals.
Well, and
And
you're also using more advanced stuff than what's on the market as well. So it is, as you're looking at that, and we look at 3D
true.
exosomes versus the 2D that's traditionally out there now, you're already going beyond the industry when it
Right.
comes to the way you're doing your treatments. So
Good point.
yeah, yeah. Just a little plug, you
Yeah,
know.
thanks. But it's true,
No, it
and
is true. It is true.
it's to me at this point, if you're spending, a couple $1,000s on a treatment, you need to get the good stuff. I
Correct.
mean, we're not
Correct.
fooling around, right?
No.
This is
No.
this, and as a person who only has a part of a knee with the part,
Yes.
like I know how it feels, and I actually, I've had my knee injected, and I can tell a big difference,
Oh,
and
absolutely.
it makes a big difference. So I think that it is significant, and definitely having that change in thought pattern as far as don't worry about it's not so much the severity, but I think we can
Mhm.
all agree the more time something has to take traction or gain traction in your body, whether it's
Mm.
Epstein-Barr virus or
Mhm.
Lyme disease or COVID, spike proteins, things
Yes.
like that, the longer that goes on, the more severe your symptoms are going to become. And the more comorbidities you're going to have start to appear. And so it's been interesting because when we got into this, we didn't
Mhm.
know about you or,
Yes. Yes.
acellular. And so we started with the exosomes, and I'm going to use Elena since she's not here.
Yes. Yes.
We're going to
Yes.
talk
Oh,
about Elena,
she's a
but
great story.
I know we love Elena. She's my little canary in the coal mine. She's
Oh,
so amazing.
she
But
is.
we started like just, and I tell her it's like we've built to this foundation because we used everything we had,
Mhm.
and we could see changes. And she's a
Yeah.
youngster, and it's
Yes.
funny because I'm a good deal older than her, and her husband's my age, and
Ah.
yeah, and he was like, I don't even know who you are anymore, because but she did, after she had done the things we learned about acellular, and then she went straight to that. The difference,
Yeah.
her resilience was amazing,
Oh, yeah.
and just the things that she's able to do, and she sees it, and it's so exciting to just see, because it's not always a broken bone, right? The
Correct.
x-ray showed a
Correct.
broken bone, and now the x-ray shows healed, but there are so many factors, and I think all of our viewers and listeners out there who do have autoimmune, whether it's fibromyalgia, I mean, that's
Mhm.
hard. That's like the
That
file
is
13 of autoimmune.
correct.
We don't know
Correct.
where to put you, so we're going to put you over here. But to see more mental acuity, lack of fatigue,
Oh, yeah.
being able to do things that you quit doing 20 years ago, those are
Correct.
huge milestones, I think, because it's not all just the hard data. I think you do have to consider the anecdotal, but that also makes this difficult because, I mean, despite there being how many tens of thousands of white papers on
Oh,
regenerative
man.
medicine, on stem cells and exosomes, and more is being done every year, there's still so much that it's like, well, we have a measurement for that, or
Correct.
we don't
Correct.
have a measurement for that.
Yes. No, it's so true. Well, and you know what? I mean, just take a look at my case, what even got me here. I just celebrated 9 years after a heart transplant that came from an unknown cause, later turned out to be an abnormal gene expression that
Yeah.
was just not making the right protein to allow my heart to beat properly, and then it fails, you know? It is, but then the only reason I discovered is because of neuropathy. And then after the heart transplant, they think the neuropathy is going to get better. And instead, it got worse and nearly took me out. And it was these same products that we talk about that I use to get myself back on track, get off all those massive doses. I mean, when I tell people the massive doses of medication, we're talking about going through every drug that was possible or thought of,
Mm.
doing different trials, doing all kinds of stuff, and getting to a point where insurance didn't want to reimburse any further increase in medication because I was already on like 675 milligrams of Lyrica. I mean, when you look at something like that, somebody with neuropathy might be on 100 to
Yeah.
300 milligrams,
Yeah.
and me, I'm on 675 looking for additional,
I mean,
you
you're a
know.
tall guy, but you're not that big.
No, 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 no. Exactly, exactly. No, it's the truth. And then they had me on tramadol and hydrocodone to try and supplement the pain. And I used to joke with people and go, "Man, I would walk down a grocery store, and if somebody walked up right next to me, I almost fall over into the cabinet because my mental acuity trying
Mm,
to be able to balance got off from
I
taking
bet.
that kind of medication. So,
Yeah.
we look at this, that was one of the things that really attracted me here because here into the regenerative medicine space
Hmm.
was because I wound up getting connected with a group that was doing an IRB study with on 5,000 patients, and their lead investigator was a transplant cardiologist out of Cedars-Sinai. And
Wow.
so they had developed the acellular product that he was studying, and there were about 10 categories that they were approved for in that. And I think that will lead us to kind of the COVID side of things. But, viral was one of those conditions, cardiac, type 2 diabetes, autoimmune, neurological, orthopedic, pulmonary. So we'll get into some of that, urology, aesthetic. There was all kinds of different ones that were inclusive in there. And there was 3 published studies that were done on that product. And it just so happened that one of them was on COVID-19, and these were patients that were critically ill in the hospital, in ICU. And we saw amazing type of results from that. I mean, as a matter of fact, it was a double-blinded placebo study, meaning that nobody knew what was in the product. There was 2 different types. There was the placebo, which could have been saline, and the other one that had the stem cells.
Yeah.
And the outcome on that was phenomenal because what we really saw is that in the placebo group, there was a 47% death rate. In the stem
Yeah.
cell side, or the acellular stem cell side, there was a 7% death rate.
Which
So
is crazy. Let's talk a little bit more about that study. I mean, I love just the results,
yes, yes.
that came from it because
Oh yeah,
they, yeah, I mean, and people, and I just want to say people who come at this whole space with, well, where's the double blind placebo, blah, blah, blah. And I always want to go back and go, well, where are the ones that were done on vaccines? Thank you very much.
correct.
The
Yes,
COVID shots,
yes.
So,
No,
not
it's
that I
true.
want to get booted off YouTube or anything, but
Right.
you know, just saying,
Yep.
there were some things that were not,
Oh,
they
correct.
weren't studied. So it is so exciting to see this kind of study done. So tell us more,
Correct.
Mark.
Well, so I mean, here's the thing. Each one of them were, well, not each one of them. Some were given, just like you said, the normal saline, solution, but then the other portion of them were given about 3 cc's of this acellular stem cell. And each cc, they used about 8.45 million stem cells coming from umbilical cord tissue, which is one of the richest in regenerative proteins. And so when they did this, they did it through an IV infusion. But what was interesting too is while they treated the patients, they decided that they were just going to test the practitioners that were in the ICU unit at the same time. And so there was, I think, maybe 15 or 18 practitioners that were
Mhm.
in that.
I think
The
it's, yeah.
15, yeah, 15. What I thought was very interesting about that one, and it's going to play into immunity of things as well, is that none of them got COVID during the study. And so, even though that was kind of a sidestepped kind of trial and not maybe the main purpose, we thought, well, what role could it play on the immunity? And that's what they suspect, is that they had kept their immune system heightened, and so that they were able to resist that COVID vaccine, or not the COVID vaccine, but COVID when they got it.
Yeah. Yeah. And so using those mesenchymal stem cells, the
Correct.
acellular, they basically were showing for the people. And I think, I was really glad that they noted this, that nobody in the study was given the remdesivir, which, I
Yes.
mean, in my opinion, I think
Yes.
remdesivir and the data shows is responsible for a lot of damage and
Right.
death.
Right.
And
Yes.
so that was not even in the picture yet. So thank goodness,
Correct.
right? Because
Correct.
I feel
Correct.
like that could have potentially skewed a lot of things.
Oh, absolutely. And
But
I mean, that just shows the power of regeneration, right? It
yeah.
is because you know what? Everybody heard the cytokine storm, so, and a
Mhm.
lot of people, and I was just giving this example the other day when I was trying to talk to somebody. I'm like, when you think of a cytokine storm, I mean, your body's in this hyper state, right? So I
Mhm.
give the people, I said, look, if you were trying to build a brick wall, and you put your scaffold up and you're a bricklayer and you're running back and forth, but then you've got 40 people that are down there throwing rocks at you. while you're trying to build this, the first thing you're really trying to do is you can't concentrate on laying a brick wall. You're trying to defend yourself.
Yeah.
And I said, and that's really what that cytokine storm was going on, is it was very tough for the body to repair itself because it was always in fight mode. It's being pelted.
Yeah.
So what's the first thing that it tries, what those stem cells did is it went in and removed all 40 of those rock throwers, and then all of a sudden created an environment where now it could rebuild the scaffolding of the tissue. And that's kind of the things that we're suspecting that are coming out of, when we saw that study that was occurring, is we're rebalancing the immune system.
Mm-hmm.
We're, everybody's putting their rocks down, and now we're just getting into build time.
Yeah. And so, and in rebalancing, you're really preventing that overactivation, that overexpression, which is such a big deal with all autoimmune, right?
Well, and I wound up getting, during that time frame, COVID. And I mean, for somebody that was on immune suppressing drugs, it took me 3.5 weeks to recover. But towards about midway through, I wound up doing that same therapy for myself. And it was crazy because I didn't think I had anything in my lungs, but within about an hour, all of a sudden I gave this one big cough and my lungs just released something. But it was so raw, right, that when I would start talking to you, I'd almost go into a coughing attack because it was so irritated. But I will say this, maybe for, 3-4 days, something of that nature, I dealt with that kind of rawness. And then one morning I wake up, my lungs were perfect. I mean, here's the other interesting part. As a lot of people were going down after getting COVID because of all the inflammatory reaction that was happening in their body, I suspect that part of that inflammatory process and taking those stem cells, because they're attracted to that inflammatory process, played a role in helping me get better, because I wound up getting off of more dosing of my medication during that time frame. So after COVID, my neuropathy had improved. And again, that's anecdotal.
Sure.
So I didn't run a study on myself, but I sort of suspect that something might actually occur while the body's in an inflamed state, that we could see some improvement in that neuropathy. And I did.
Right. And the study was also, drawing these conclusions and saying, look, we think that, the mesenchymal stem cells, the acellular, exert beneficial effects by improving like the lung microenvironment and protecting the alveoli, the epithelial cells, and promoting that tissue repair. And lungs and heart, right? That's what it came down to with COVID. And then preventing the pulmonary fibrosis, that's huge, because what else does that? And then just improving overall lung function, which of course, if you've done all these other things, lung function's only going to be improved.
Correct. And everything else improves from that, right? So it's one little point. And if you get that under control, you have that kind of reverse, rather than tanking, all of a sudden now there's a rebuild stage.
Yeah. Absolutely. So I love talking about the acellular stem cells. I think it is fascinating. And I think when we look at it, especially for our audience out there, if you're going, oh, well, I've been sick for 50 years, or I've had this diagnosis for so long. And of course, we don't get diagnoses till we're, a long ways into many disease processes. And especially if you're in the chronic disease realm, and we're limited to only those things which we can label. And I think there's a lot of unknowns still. But
there is. And here's the thing too, Sharon, as we're sitting here talking about it, I think it's also important for people to know that, these things aren't FDA approved yet. Most of them are being regulated in a fashion.
Thank you for bringing that up.
Yes. No. But, our companies and our labs, we're going down that pathway. I mean, we're raising capital to try and bring a couple of new products through that way. We have other products that are already in that process. So there's a lot of stuff that's happening, and it takes a little bit of time in order to get there. So, we want to make sure that everybody's on this podcast recognizes that, hey, look, we're sharing information about this, but we're not trying to make any claims to anything. At the end of the day, we just want to play a role in changing healthcare. And it's and this is the way healthcare is going. I mean, it just is. And
well, and we've known for years, like everything was the germ theory for so long, and everything had to be an antibiotic, and now we've gotten less and less so, and they want to use biologics, or the monoclonal antibodies and vaccines and everything, which I think has a lot of problems
Yep.
yet to be sorted.
Yep.
But I'm waiting and watching. And I think too, being a naturopath for so long, I am still going to default to the timeless.
Correct.
What has
Correct.
nature and what has God's creation already given us that's out
Correct.
there
Correct.
that we know we can trust? Because I say this and my husband rolls his eyes, but I'm always like, I don't have a big appetite for risk. And he thinks everything I do is risky.
Yes. Yes.
But if you look at, one of the basic tenets of medicine is to first do no harm. And this is one of the beautiful things that we haven't even touched on yet. But with all of these products that you're talking about, we're not harming
No.
anybody. We're not
No.
worried about a tissue rejection issue
Correct.
with
That's
any
correct.
of this. We're really just providing positive information, right,
Correct.
for the
Correct.
body that is
No.
it's already been there.
Well,
So
and I think too, we're trying to make this. We want this to become mainstream, right? So it's a perfect
absolutely.
example is like with my wife. When we first started dating, I'm like she was having back issues, and I kept trying to tell her like you should do these sort of exosomes or whatnot. Like I have somebody that can help you with this, and she's sitting down there going, "Well, thank you very much, but I don't know you for very long, and I'm not quite sure I believe this because my doctor doesn't know anything about this." And I'm sitting down there and going, but you have just come back and said that you're going to have to do surgery. That's your option. And I'm like, if you want to avoid it, you could try this first. And and here's the thing is, I'm not against surgery. I'm alive because of surgery. I've been through
Absolutely.
multiple surgeries in the past. But we're looking at this and going, what if this could be a first line defense? And that's exactly what I tried to share with her is going, try it. If it doesn't work, then you still have the surgical route there. But if you do the surgical route and something doesn't go right, or maybe you don't heal perfectly, now all of a sudden you could have a lifetime of issues. Though many people will walk out perfect, there is still the subset that said, hey, look, I'm worse after surgery. So
Yeah.
why not take a more natural way, like you said, the way God intended, to try and restore that? Well, what's interesting about it is it wasn't her low back, the herniated disc that they wanted to do the surgery on that was the issue. It was the fact that she had osteoarthritis on her facet joints. When they treated that and kind of, shall we say, oiled those facets, she's never had a problem since. Like we're talking about 4 years later without any pain. Now this is somebody that was going to walk into surgery.
Yeah.
It is, and again, like I say, it's not a talk against it, but let's look at it as a first line defense.
But the paradigm in Western medicine's cut it or drug it. And
Yes.
and it is
I love
very
that.
short-sighted. And I think that, nobody beats us at saving
Right.
lives. You're proof
Correct.
of that. Your
Correct.
life was
Correct.
saved. It was
That's
a
right.
life-saving surgery.
Oh,
But it
absolutely.
didn't mean that it made you healthy. And
Correct.
that's where Western medicine falls short is, just like, anyone, you go to the emergency room and they care about helping you live.
Mm-hmm.
Their concern is not your health 6 months
That's
from
right.
now, right? They
Correct.
don't care
Correct.
if you have enough digestive juices. They just
Correct.
don't. Or if you're constipated. That's not their problem.
That's it.
And they're not worried about band-aiding those things either. If you go to
Correct.
a specialist, they only worry about band-aiding it. They're not worried about necessarily what made it that way. And I'll never forget having a gastroenterologist tell me that he didn't see why the food that my grandmother ate would have any effect on her digestive system. And I thought, is he just trying to baffle me so I'll shut up? I don't even know what to do with this statement. It's so absurd.
Yes.
And in my head, I was like, I think we're done here.
Exactly. Oh my
So-
goodness. Now we have whole sciences around that,
Yeah,
it is.
yeah. But I think, that's where, and so, surrounding this entire conversation, because I do want to move into natural killer cell exosomes, but I think, like you said, the acellular is giving those signals for healing. And like your issue was a
Correct.
genetic expression. And
Yes.
they say our genetics are what loads the gun. It's our experiences and exposures that pull the trigger. And
Correct.
that's a really good word picture. But I think it's also important to remember in doing any, stem cell or stem cell byproduct, therapy, we still need to understand what caused this. And so
Correct.
not running on a broken leg, right?
Correct. Correct.
And I've seen this with people doing the exosomes,
Oh,
and they go out and they feel good. And so they start doing stuff where they haven't actually corrected the underlying features.
correct. Correct.
So I always encourage people, and now I'm kind of pumping the brakes and saying, no,
Yes.
you can't do exosomes until we're addressing this root cause.
Correct.
We're going to clear XYZ, and and I want them to understand it, because it is a way of thinking, right? It's not.
Yes,
We're
it
not
is.
band-aiding here. We do want to get you better faster.
And I'm glad you're talking like that one, because so many people come within their specialty thinking this is the only way to get something done, where I love how we talk about this from a holistic standpoint. I mean, it is the food, it is the exercise, it is all the other elements that you're doing. Hey, these products only play a key, and what I think is interesting as well, they had done a study before that was talking about, when you're born, like 1 in every 10,000 cells in your bone marrow was a stem cell. Then they went on to show that at the age of 18, it was 1 in 100,000.
Yeah.
Then by the age of 35, it was 1 in 250,000. By the time you hit 50, 55, it was like 1 in 450,000. By the time you were 80, it was 2 million.
Ugh.
1 in 2 million. One
Yeah.
stem cell for every 2 million. I mean, imagine the workload on there. I mean, that's just like your boss coming in and just dropping paperwork off and going, I need this done by 5 before you leave. You're just kind of like, I'm exhausted. And there's a thing called stem cell exhaustion, where the ones that you have left are just like, no
You
mas.
can do nothing else. I know when
I'm out.
when I do the exosomes for joint injections, oftentimes I'll add, or even sometimes, the aesthetic parts of it, like the facials or whatever. We want to know, where we might use PRP. Okay, how old are
Correct.
you? And
Correct.
because is it even worth the blood draw and
Oh yeah. Yeah.
spinning your blood? I really feel like
That's right.
sometimes let's just skip to the exosomes.
Yeah.
So,
I walk by and go, man, if you feel thirsty for something healthy and you see a grape on the table and a raisin on the table, which one do you grab for? Nobody ever tells me it's the raisin.
That is so true. That's a good point. Okay, so let's shift to a different approach that, often complementary and done after the acellular treatment, and that's the natural killer cell exosome therapy. But before we dive into it, I just want to kind of review for our audience what natural killer cells are, because they sound diabolical.
Yes.
But they're a very important part of our immune system.
They are.
It's our innate immune system, or what we're born with.
Correct.
And natural killer cells play a big role in defending the body against viruses and cancer. And then senescent cells, or zombies, zombie cells.
I love it.
Which
we just come out of Halloween, like, why are we not pushing senescent zombie cells?
I know. When I saw that, I was like, that's perfect. Now I'll never forget what they are.
Yes.
But a zombie cell, or a senescent cell, is a cell that has basically stopped dividing, but it does remain metabolically active, correct?
Correct.
And it gets into that state just because of stress and DNA damage, or just it's divided as many times as it's going to.
Well, you can call it a grumpy old man, right? It's like,
that's a good
it was supposed to die off, but instead it survived, and it's running around just pissing everybody off.
It survived the apocalypse.
That's right.
Now it's just being awful. But while these zombies,
and I'm being very respectful to our grandfathers out there, but
yeah, for sure. Even our grumpy old men.
That's right. That's right.
Love them. Yeah. Okay, but while senescent cells, or zombie cells, can be beneficial, right, in roles like wound healing and in preventing cancer, but when they accumulate with age, it's linked to like chronic disease.
Correct.
And because they do secrete a lot of inflammatory molecules.
Well, you know what, too, and I'm glad you kind of bring that up, because a lot of people don't understand where senescent cells come from, because these are cells that are supposed to be going through their normal death cycle. So, and as they're transitioning from life to death, what happens is they actually, during that time frame, and when you talked about it for wound care, express a great amount of positive molecules that can make a difference. But what happens is then they don't die. Then they float through the system, and they start expressing bad signals, which then start leading to inflammation in the body. And we know that inflammation equals disease. So now all of a sudden, you've built up an abundance of these things in your system, and then now disease is starting to set in. And yeah, I mean, it's a vicious cycle, right? It
Yeah.
is. So
Yeah.
yep, go
So,
ahead.
so tell us then, what are natural killer cell exosomes and how are they different than the others?
Yes. So, this is what I love, because I love natural killer cells just on their own. But natural killer cell exosomes are really an extension of that natural killer cells. It's what they push off in order to support and kind of, I would say, extend their reach around your immune system.
Mm-hmm.
Because what happens is, I always look at cells that are abnormal or that are struggling have a tendency to throw up a white flag. It's like a little tail. And what it's doing is it's marking itself that these natural killer cells will come along, gobble them up, and help them through their death cycle, and then they're off and running. The challenge is that certain cell structures, whether it's viral overloaded cells or cancer cells, they have this unique way of kind of hiding the flag. And it's and when you do that, all of a sudden it's kind of like, okay, now these natural killer cells on their own can't respond, because there's certain receptors that they have on their cell structure that what these cancer cells and stuff throw off will quiet them and let them go, okay, nothing to see here, let's just keep moving on. Those same receptors are not found on natural killer cell exosomes. So these little guys are running around going, the heck with this. Like, I see something right over there and I'm going to go get it.
X-ray vision.
Yeah, exactly. That's exactly right. That's exactly right. And so those natural killer cell exosomes go and they see those tags. They latch onto these cell structures, whether it be cancer, whether it be viral overloads, whether it be senescent cells, and they start a process to take that cell through its natural death, or just like a ninja, assassinate that cell. And we all hear about cancer because cancer's got some very unique benefits, that not benefits to the patient, but benefits to itself for survival, like the ability to extend their telomeres so that they can divide almost exponentially, or the way they can throw off, transforming growth factor beta, which at that point is sending signals to these natural killer cells that, hey, there's nothing to see here, because that NGF is normally playing a role in quieting the immune system. So it's like all of a sudden it's like the fire's in the basement, but you can't see it. It's so just go on.
Yeah.
Where these natural killer cell exosomes going, well, you had a window into the basement, and I just saw the fire down there, so I'm coming in order to take this out.
Yeah. That's amazing. And so the natural killer cell exosomes also, they have these cytotoxic proteins
They do.
called
Porphin and granzyme A and granzyme B. So porphin, and you kind of think of it kind of like pore. So porphin, basically it punctures a hole in that abnormal cell structure, giving it an opening for these exosomes to release their cargo. And when you start working with granzyme B is one of those key products that starts killing the DNA in that cell, while the granzyme A is playing a role in destroying the mitochondria. So here you're killing the expression, and then you're killing the energy center at the same time. But as well, what happens is you have these microRNAs, which literally go into that cell and start telling it, hey, this cell's supposed to die. You need to go through normal apoptosis or cell death. And so what happens is, what gave these cancer cells their strength no longer is available. And so these cells start to die or implode in on themselves. Just kind of like with overloaded viral cells. Like you're seeing these viral a cell being a single, but all these viruses loaded into this cell structure. Well, that porphin can get in there, open it up, and then send all these messages in, and it starts breaking down and killing all these viral overloaded cells. So it is, in doing so, instead of these things hanging around and hiding out to come out at some future point, they're dying before they even became present.
Yeah,
and that's
which is amazing.
Oh yeah.
Because when you look at how many people, like Epstein-Barr virus,
Oh yeah.
that
Oh
is
my.
responsible for
Correct.
in autoimmune land,
Yes.
and even though they don't prove it, I mean, it's just 9 out of 10 here when we, they have an autoimmune disease or they have chronic fatigue and we test their
Correct.
EBV titers. Woo,
Yeah,
high.
off the charts, right?
Yeah. Yeah,
Yeah.
it's always so high. And so to realize that you can take, these little proteins and it actually changes the
Hmm.
gene expression in those viral cells, and it's like,
Hmm.
yep, you're not replicating anymore. It's like
Correct.
completely interrupted. So that's amazing. And then when you think about other viruses, which I mean, I know I'm always peppering you
Yeah, no, no,
with
no.
this,
I love
but
it. I love it.
what that could mean for other viruses, I know I need to do more research into it, but just looking at a lot of the like herpes virus,
Yes. Well,
um,
here's the crazy part about it. The exosomes don't have the receptors. So all they see is the flag, right? So
yeah,
that's the beautiful part about the natural killer cell exosomes, where some of these other parts of your immune system have specific, receptor. I always call the receptors kind of like the lock, and then there's got to be a key,
yeah,
and what will happen is the locks are present on the major cell structure, but on the exosomes, they're not. So they get to do things that the other one can't, you
yeah,
know. It's and like I said, the one's like a little ninja. The
yeah.
other one is like a strong man. It's kind of like comes
That's
in and I'm just gonna take you down,
yeah.
throw myself on top of you and bring you to an end. The other one's very surgical precision and going, it's
One's going to strangle you, and the other one's going to disembowel you.
correct. That's exactly right. That's exactly right.
Yeah, yeah. Well, but what's really cool too is just, when you think about a lot of cell-based therapies, you do get the
Mhm.
cytokine storm.
Yes.
And
Yes.
do we worry about that with natural killer cell exosomes?
So here's the key. Not so much but we do want to watch for it, right?
Sure.
Because IL-6 is one of those that plays a role in that, that will play a role in that kind of uptake in the storm.
Hmm.
And when you have a viral overload that's active, that will ramp up. And so it can look like a storm. So it's very important from you as a practitioner level that you're taking a look at these and doing the proper diagnostics to be able to evaluate them as they go through. We haven't seen anything in the sense of that it has a negative side effect, but the immune system goes through a natural progression of ramping up before
Yep.
it calms back down.
Yeah.
And that's why, when you're looking at this sort of stuff, this doesn't just go into any practitioner's hands. You want to be well studied in this because you want to understand that innate immune system and how it works so
Hmm.
that you can respond to something if it didn't. But, in this sense, a lot of this will have the calming effect
Yeah.
on the immune system.
Yeah. Well, that's when we do PRP, because you're essentially using a person's own stem cells.
Correct.
We don't want them using NSAIDs,
That's right.
in
Yeah, you
those
don't want to
those
calm that
first
inflammation.
days. And that's why we, recommend people, you want that cytokine storm, but we
Correct.
want to know, how big did it get? But
That's
using
exactly
your
right.
own stem cells, of course, there's less, less
Correct.
risk. And then
Yep.
of course with the
We want a
exosome.
rainstorm. We don't want a hurricane, right?
Exactly. We need the rain, just not the damaging winds
That's
and
right. That's right. Exactly.
flying roofs.
Exactly.
That's for sure. And then there's also I guess, because is it because of the small size that we get better tissue penetration with the exosomes versus,
We
stem
do.
cells?
And as a matter of fact, that is one of the key elements is it is the size. So they can kind of get through and fit through crevices that you couldn't set a large structure through.
Hmm.
It's like one of the things that we talked about. Well, we didn't talk about it in this one, but you and I talk about it is the fact that like exosomes can bypass the blood-brain barrier.
Yeah.
Well, where a normal stem cell doesn't have that equal capability. And there's some topics of discussion about how stem cells can make it past blood-brain barrier, but for the most part, how they're affecting more of these neurocognitive type issues is through these sort of through exosome therapy because of that capability, small enough to get through and drop off a positive cargo load.
Yeah. So what would you say would be some of the advantages of using natural killer cells or implementing them, integrating them into like cancer therapy? And I know we're not giving treatment advice.
Right, exactly.
This is education and entertainment.
Yes, exactly.
Talk to your doctor.
No, and I think here's the thing is I think where we see this happening in the future, and I hope that one day it gets something that gets passed through. There's a lot of investigational new drug therapies that are out there, but what's interesting about it is a lot of them are under neurodegenerative diseases because of the way that it can actually calm down that neuroinflammation, both cognitively and within the body. But when you look at it at the same time is what happens if we could do something like this where these natural killer cells could be playing a role with chemo or other oncology type drugs in order to suppress this? Or what if this could become a first line defense to even kind of prevent us from getting there? I mean, when you take a look at senescent cells, hey, if we knock them out prematurely, do we also knock out its future inflammation, which would lead to future disease? It's kind of like that. It's kind of like working ourselves backwards. It's like what we can stop today doesn't show up tomorrow.
Exactly.
And so, yes. So when we're looking at that, even from a cancer specific area, or I mean, like you take Lyme's disease, where you and I talk about this, where the after effects hang around for a long period of time and people suffer. What if we can go in there and kind of start affecting these things before they ramp up and cause additional damage? But then at the same time, I think what's great about these cell structures is that they're not just about knocking something out, they're about the rebuild process at the same time. So when you're using this, one segment of it is doing the knockdown while the other one is doing the rebuild. Burn the house down, but rebuild it the way you wanted it, you know?
Yeah. And if the whole burn the house down, I mean, that really speaks to like, how do we do cancer care? I mean, it is so destructive. And I still hate that there's there is still the occurrence of, if the cancer doesn't kill you, the treatment will.
Yes.
And I mean, it knocks you out. And again, it's like, we can poison you right out of a tumor, but doesn't mean you're going to be healthy at the end. And I think looking at the natural killer cell exosomes and the potential benefits there are, not having this. Well, first of all, the level of toxicity that is going to come about with drugs, but then also you don't develop resistance, I don't think, right? Like your cells aren't going to become resistant like they would to a drug.
That's exactly right. That's exactly, and this all came about for me when my dad passed away from cancer, where the natural killer cell became a very interesting topic. And, he was doing some regenerative therapies along with his oncologist, now the oncologist was all for it, but by the time they started doing the regenerative therapies to him, he was supposed to be dead in like 6 weeks. And he was like, well, what could go wrong if you try this? So he went and started doing it and started to actually get better and repair. I mean, you're talking about a guy who couldn't walk 10 to 15 feet in an airport without having to stop to taking a breath, to 3 months later is walking around Main Street up and down stairs and starting to think about exercise again, But the challenge is that he got healthy enough that they thought, well, the other chemos aren't working, but maybe this new experimental one could. And that experimental one was just too much for his body, and he eventually just had to tap out. And there was nothing in the regenerative side that they could do. The toxicity of that was just so grand. So when I looked at that, I started thinking to myself, man, we saw the role, how it stopped the progression and how it gave him additional life and also gave him strength while he was going through chemo, but it didn't necessarily reverse it. So one was playing more reparative and kind of creating the healthy environment, but it wasn't necessarily, it didn't have a way to fight the cancer's natural progression to take over. So then when these natural killer cells pop in, all of a sudden, boom, these things are being studied all over the place in major universities and hospitals. And I'm like, maybe I need to play a role in bringing something like this forward, and so that's, this is one of those products that we would really love to see making it through, FDA trials and, making it to mainstream. So it is because of the great benefits. So we'll see how that works out. And if not, at least it's a great immune support product, right?
Absolutely. So one more thing I want to talk about with the natural killer cells, and that's like the neuroprotective benefits. So when you look at, Alzheimer's and dementia and Parkinson's and ALS and MS and I was starting to look at this when I first got into exosomes earlier this year, and just looking at the regular 2D exosomes, and they offer amazing benefits.
Correct.
But it's so interesting too to think, okay, with the brain, like I have people, whether it's migraines or if I always say if it's something in the head, the brain or the sinuses or whatever, I'm gonna start having them do some intranasal
Yeah.
exosomes. Now, not the natural killer cell
Correct.
exosomes, but I think just accessing the brain and offering some level of benefit. Can you speak a little bit to the neuroprotection that we get from the natural killer cell exosomes and how that is looking with these neurodegenerative diseases?
I mean, that's one of the great things. I mean, like we've seen the uptake in, Alzheimer's and dementia and all that sort of stuff. And when you're looking at it, there are certain plaques, there's certain inflammation that's starting to develop, that these natural killer cells are playing a key role in terms of calming this sort of stuff down and giving the body that ability to heal itself. But the other part too that we saw in some of the studies that were done is that it was also sparking brain-derived neurotrophic factor, which is playing a big part in reestablishing kind of neural pathways again. And so now improving the overall cognition. But as you kind of like go through, there is even though natural killer cells, we look at them as killer cells or assassins, that's just because that's what their primary initial job is. But what's really happening is on the back end, there's other microRNAs and other things that can kind of shut down certain expressions that could be contributing to the issue. So you almost kind of have to think of it as a little bit of an epigenetic deal, where you can come in and you can influence the way the genes are expressing themselves, so they're expressing the right type of proteins. I mean, I'm the perfect example of finding out later after the fact that what if I had done stem cell therapy, or what if I had done other type of things, would my genes have expressed properly to where my heart could have functioned properly? I don't know the answer to that because I never got to get there, right? But the reality is that's what science is showing, is that it's playing even a micro role in terms of influencing how your DNA starts to give those cookbook instructions to your body to make key proteins. Mine, just to kind of give you an example of that one too, because the way they looked at it is, if you have this amino acid chain and it has to be, we'll say 50 chains long, but it only makes it to chain 47, which is what happened with me. What happens is the cell rejects it and actually puts it through an apoptosis or breakdown, an enzymatic breakdown, to where it just kills that protein. Well, now that protein isn't being used in order to help my heart pump properly, because it just was never developed correctly. So something of what we're doing here is going, hey, now we're going to help your epigenetics or your DNA express the right cookbook instructions so it makes the full 50 chains, folds it properly, and then puts it into use. So that's where science is really seeing a lot of this stuff going. And it's fascinating to see what's happening at all these varying levels. Never in my wildest dreams did I think I'd be into this much cellular biology. It is.
You sound real smart.
Oh man, no. You're giving me far too much credit. I'm just passionate.
Hey, you know what? That's important too.
Oh yeah, no, I can't do it without the likes of you, Sharon. I mean, trust me, it's I can help on these development type things, but you all have to physically bring it to the patients and kind of show us what that looks like.
I love the whole exosome space. Just the results that we're seeing are just astounding, and it's really, I mean, it's amazing. It's just nothing short of amazing, and everybody gets a differing level of response, in the beginning, in a different time frame. And
correct.
But it is so exciting just to see, like one of my clients who was really worried about cognitive decline, and we got him going, and it wasn't just exosomes, but it definitely it got it going. And then he came in and he said, I took a class.
Oh yeah.
He's retired, and he's he's used to being smart and sharp and understanding, and when he wasn't remembering very simple things, like the short-term memory was going, and we got him started on the exosomes, and he's like, I can learn again.
Well,
And I don't ever want to stop learning, and I think we take it for granted.
That's it. And here's the thing too, and a lot of people don't realize, you always hear it in the Bible for sure, where it's like life is in the blood.
Yeah.
And when the blood retracts, everything else retracts with it. Yeah. And that really kind of struck with me one time when I heard that, because I'm sitting down there and going, yeah, that was my situation. So when my heart was failing, what a lot of people don't realize is the body tries to protect itself. So it retracts blood flow from your extremities in a protective nature to make sure that the organs are well supplied. Well, as you're retracting blood, you are retracting nerves. The nerves start to die along those pathways. And so when you're seeing what these things are doing in the brain, is that you're also realizing, hey, they're creating new vascular connections, or new vascular supply, which is then creating new neurological connections because now it's got the supply. So as we look at these sort of things, it's really about bringing blood flow back to the area, and then everything will start to function. So that's another part that we're seeing in the brain side of the equation is there's a combination happening there.
Yeah. And it is exciting, I think, especially with regard to Alzheimer's and, doctors like Dr. Bredesen, who's treating it more like the syndrome that it is. That I keep,
Correct.
telling people, just like with cancer, I don't feel like there's ever going to be a cancer drug or, a cure.
Correct.
It's not one thing
Yes.
because it's not a singular cause. And the same thing can be said of a lot of the neurodegenerative issues that we see, especially with Alzheimer's and Parkinson's. And, my first go is we better look at your toxin load.
Yes. Yes.
But just because it was, maybe triggered that way doesn't mean exosomes don't have a place. I mean, they have a huge place because that's going to help get you. I think sometimes you got to feel better to do better.
Yes.
And if somebody has to wait a year
Correct.
better, they get hopeless. And so that's another space that I feel like exosomes help to fill.
Well, you nailed it with the word hopeless, because the reality is it's amazing what hope does for healing.
Yeah.
Because even for myself, when you start seeing yourself coming off medication, or you start to see yourself recovering faster after exercise, or just, the things that you can do in life that you couldn't before, hope comes back. And then it's a forever journey of prevention and continuing to treat. And it is, and it's not something that has to be expensive. I mean, that's the thing is most people think, because they think, oh, you know what, people are going to Mexico and they're spending $25,000 and $50,000 in order to try and get these treatments done. And you're like, no, it doesn't have to be that expensive. Like, we're in a stage now where if we're starting these conversations with our practitioners and more patients are coming in, the companies get a greater infusion to scale. When they get to scale, they get to bring the price of all these goods down. And that's what our ultimate goal is that how do we create enough awareness that gets us in a position to scale and bring the cost down so that everybody has access? And I will tell you, just in the last 5 years, scale and bringing that cost down have happened in a dramatic fashion. And it's all happening because of the consumer awareness. And then we're watching doctors who are like yourself, who are tired of the way that modern medicine is going. And like I said, big parts of that are key, and you're still utilizing them, but there's parts where you can start working the prevention and regenerative side of things. Well, now all of a sudden we're seeing a different version of healthcare, and it's a beautiful thing to see.
It is. It's exciting to be a part of.
Yes, yes, it is.
Yeah.
Oh, trust me, I feel very honored to be working alongside of you, and I say that from the deepest part of my heart, because it is. No, trust me, because you have practitioners that they do it because they know that it's beneficial, and then you have those that are digging down and trying to look at things from a very deep disease specific elements, like what about this disease is actually causing this? Do I have to work on mitochondria? Do I have to work on some other aspect? Is it just an inflammatory? Is there a particular cytokine or that's playing a role? Is it in the food? Is it in the gut? Like, there's again, I preface this is that we're one phase of health, but there's multi phases to create that health. And look, you and I, we have those conversations. What people do with their diet and exercise could be that's the first line of defense, right? Yeah. It is. But here's the unfortunate part. I have this extreme affection for pumpkin spice latte, so I'm going to have to keep doing these therapies, because there's just certain things I'm not willing to give up on.
I think I'm going to have to send you the healthy recipe for a
oh my goodness, yes. Starbucks has to take it away just for me to stop doing it.
Yeah.
Thank God it's seasonal.
We love the pumpkin.
Yes.
Okay. So the last part, I want to just talk, briefly kind of about, because I want to dig too deep, because,
Yes.
talking about combination therapies, there are endless possibilities.
Yes.
But I want to hear your take, but I just wanted to comment on Elena,
Yes.
because, doing the exosomes, the regular 2D exosomes and even the 3D before I understood the acellular, and putting her, we still feel like she had a better foundation to work off of.
Correct.
And I do understand then the other side of that, where it's like, well, if we just started with acellular, maybe she wouldn't, need as many. But I think, even with she and I discussing, the economics of it, it's, do you just do the acellular and then you're done? Well, no, right? Because
Correct.
you may not even be done with exosomes, but there are other things, there's of course ozone and peptides and nutrition and
Correct.
enzyme therapy and sauna and lymphatic therapy and endless array
Oh yeah.
of
Even the best well-made car still needs maintenance.
absolutely.
You know what I'm saying? So it's the same thing there. And when you look at it again, it's one of those things is that sometimes it's just the things we don't know is why we start with certain therapies. And once we become aware, we would change our therapies, right?
Mm-hmm.
So, I mean, it's like now, a lot of times when I get in front of these regenerative physicians from all over the world, the biggest thing that they say is the challenge with the United States today is that everything is functioned around cost and they're never delivering enough to the patient to make a difference. They say we're under treating. And I think that's what you're trying to change. What I'm trying to change is kind of going, look, if you're going to do this right, it's better to invest in it up front rather than constantly be hitting, because it's one of those things that you keep doing something and you get a little bit ahead, but then you take 2 steps back, 1 step forward. I mean, you're still getting better, at some point, or maybe it's 2 steps forward and 1 step back. You're still getting better, but it's a slow process.
Yeah.
What if you could make the leap to 5 to 6 steps and then take a step back, then take 2 steps forward, a step back, it's that sort of philosophy.
Yeah. So, and so back to Elena. So she did the acellular.
Yes.
And you could really tell a difference with
Absolutely.
her, just, systemically. But then she went ahead and she did the natural killer cell.
Mm-hmm.
And it did kind of knock her down, and bless her heart, she did it like the day before she was doing a fundraiser. So she was hostessing.
Oh, yeah.
And she did it. And I will say, 3 years ago, she could not have done what she did. But,
yes.
And you've warned us, like, when you do the natural killer cell exosome, you may have like a metallic taste in your mouth, you have a headache. And she did feel less, for about 4 days.
Yep.
She was not knocked down, not out.
Correct.
But then what was funny was last week, as you well know,
Yep. All too well.
I got knocked out.
Yes.
I took my first sick day, I think, that I've taken in 10 years. And I don't know, whatever it was a 2-day bug. It wasn't strep, COVID, or flu, because I tested for all of those.
Yes.
But I had to go home and go to bed. And that's not normal for me. And even my medical assistant here, she said, "You're scaring me. You never get sick. You're the strong one."
Yeah, exactly.
I'm just going home and going to bed. It'll be fine. But Elena didn't get it. She never got knocked out, and it's not normally that way here.
Correct, because she's the one dealing with the compromise.
Hey, it's just anecdotal, but that's a big W. So
yes,
yeah, that was really exciting. But tell me, if somebody's going, man, I need both of those, what would you say to them?
I think as we kind of look, I've talked to a few other practitioners around this that play in different areas as well, just to kind of get their take. Because so when you look at this, there is, there's times when natural killer would make sense first. Then and the acellular second. And then there's others where the acellular works better and then followed by the natural killer. So a lot of times too, when they're dealing with people that have these very chronic, like take something like Epstein-Barr virus, and this is just theory. This is, conversation, and like, this is the way that people are thinking through this, right? It's is going, well, it's kind of like, if the virus is active, why put in something that's going to repair while you're still being pelted on the wall? So maybe what you do is you come in and you do the natural killer first. And then you come back when everything's cleared out, then you come in and you do something like the acellular or the regular exosomes. Now, on the reverse side, people will go, well, that's sort of suppressed. We know it's there. Why not do more of the reparative side first, get them in kind of a well state? Now they've got this immune system that is heavily functioning. Their body's in a great state of repair. It will play a role along with those natural killer cell exosomes in order to make things even better. So I'm not quite sure we have an answer yet in terms of which is right or which is wrong. I think it's kind of how your view on it is. What's causing the main problem first? Is one of them kind of somewhat suppressed?
Yeah.
And you want to create the repair? Or, I mean, like for myself, I want to do them too. But why I want to do them is more for neurological. Like, my body's optimized with the acellular at this point. So, and if there's any type of flare, I'm like going, well, what happens if I sacrifice myself for science?
do that.
Look, that's been my entire role here is that I test everything first. We don't bring it forward or try and drive it through anything unless I'm willing as a heart transplant patient to put it in my body. So it is one of those things that, sometimes I think my wife looks at me and goes, "Are you crazy?" And the answer is maybe just
Only
a
a
little.
little.
Yeah, exactly. But I'd rather something happen to me than happen to someone else, And
Yeah.
then at that point, then it's lining up with people like yourself who are strong in the science that really make this mainstream.
Yeah, and it is something that we're very excited at K6 Wellness to offer, and we love helping people design, an individualized plan of action. I don't even call it a protocol because I don't really believe in protocols and in
Yes.
functional wellness, because we each got to where we are a different way.
Correct.
And customized, individualized healing is going to be different for everybody. So yeah. Well, this is the perfect place to end our conversation for today.
Oh, really?
But I really enjoyed this discussion. I look
I
forward
love
to
this,
more
Sharon.
discussions. But
Thank
thank
you.
you to our audience for listening and watching as we continue the discussion of exosomes and how they can transform your health, no matter what underlying condition you may have. Don't forget to like and subscribe if you're watching on YouTube, and follow us on Rumble, Facebook, LinkedIn, and Instagram for more wellness content. And if you'd like to book a consult with me or Elena, you can visit k6wellness.com to learn or schedule a free discovery call. We're located in Dallas, Texas, but we work with people all over the world. So until next time, take care, be well, and as always, your health is worth fighting for.
Amen to that.